Hi everyone, my name's Lorraine.
My name's David.
This is Jonathan.
I'm Sosek. I'm Mindy, and today we're going to talk about
CJD! So what is CJD? CJD stands for Creutzfeldt-Jakob disease, which is a transmissible spongiform encephalopathy. It is a brain disorder that creates tiny holes that make the brain look like a sponge, hence spongiform. In the case of CJD, prion proteins occur in both a normal form, which is a harmless protein found in the body's cells, and an infectious form, which causes the disease. Here is Sose with the prion models. This is what a normal protein, like where the amino acids are flat like a sheet. The harmless and infectious form of the prion proteins have the same sequence of amino acids, but the infectious form of the protein takes on a different folded shape compared to the normal prion protein. The misfolded protein, known as a prion, somehow catalyzes other molecules of the protein to misfold in the same way. The result is a chain reaction in which more and more protein ends up as prions. It is believed that the protein prion is a self-replicating host-encoded agent, transmissible in the laboratory to many species, including wild and transgenic mice and non-human primates. In the brain, the proteins collect, causing dark spots in the brain tissue as seen in the picture. Additional scientific theory includes a genetic component, which may explain why the disease form of the prion protein folds differently as a result of differing amino acids at a specific site on the protein structure. Hey Lauren, how long has it been around?
Alright guys, now I'm going to talk about the history part of CJD. Creutzfeldt-Jakob disease was identified by German neurologists Alfons Jacob and Hans Creutzfeldt in 1920. Creutzfeldt was actually the first to describe a patient with pseudoparalysis, a brain-related disease which causes the inability to move because of pain.
However, Creutzfeldt's case did not meet the criteria for transmissible spongiform encephalopathy, and so the honor of the first case of transmissible spongiform encephalopathy belongs to Jacob alone.
It's good to mention that some of the clinical findings described by Jacob Creutzfeldt did not match current criteria for Creutzfeldt-Jakob disease, specifically spongiform encephalopathy. However, it should be noted that recording of similar prion disease had occurred in England up until the early 1700s. In the 1950s and the 1960s, it was shown that the disease can be transmissible. The term prion was first introduced in an article by an American physician, Stanley Prussener, in 1982. Later, a study published in the 90s showed that CJD was clinically observed in more than 100 cases worldwide. Countries including Australia, New Zealand, the United Kingdom, the United States have all been dealing with this disease throughout time.
There has not yet been a virus identified as the culprit of CJD, but we know that cases occur all over the world. So who gets CJD? Well, that's not a quick and easy answer. We do know it only affects between 1 to 2 people every million on average. As we get older, we are more at risk. A lot of people go, well, hey, isn't that mad cow's disease? Well, that is kind of up for debate. There are 4 kinds of CJD that tell you how it occurs. Variant CJD is the one that is linked to eating contaminated meat. However, most cases can be traced back to the UK, and they have since taken great measures to ensure that cows showing signs of the disease are not introduced to the food supply. The mean age of death with variant CJD is significantly lower than other types at just 28 years old. Another acquired version of CJD, for less than 5% of cases, is believed to be intragenic CJD, where it is believed to have occurred during a transplant of dura mater, brain probes, or other medical equipment that came in contact with tissues that carried the disease. Familial CJD is where it is passed down in the family, but do not worry, you cannot get it by being coughed on by someone who has it. If someone has a folded prion gene, that gene can make it into the sperm or eggs and therefore can be inherited and manifest later in life. This type of CJD only makes up between 10 to 15% of all cases. Up to 85% of cases occur with sporadic CJD. Sometimes the amino acid in the gram folds harmless prion protein randomly, like we saw earlier. The disease then develops. Gestation could be as much as 50 years, so you may not know that you are carrying it. So how do you know if you or someone you love has it? Well, Lorraine's about to tell us.
Overall, there are numerous signs and symptoms of CJD. The disease is rapidly progressive and is always fatal. Infection with this disease usually leads to death within a year of initial signs and symptoms. In those diagnosed with CJD, mental deterioration is always pronounced, and involuntary movements, blindness, weakness of extremities, and coma may also result as well. Let's go more in depth with some of the signs and symptoms common to CJD. Usually, the first symptoms that occur with CJD can be realized through many personality changes undergone by the individual. These include, but are not limited to, mood swings, anxiety, depression, impaired thinking, and typically results in memory loss and dementia as the infection progresses. The individual may also suffer from insomnia or maintain difficulty sleeping for long periods of time as well. Early symptoms of CJD can often be confused with other diseases such as Alzheimer's, so early diagnosis can be difficult. As we have already mentioned, this infection seems to spread rapidly in most of those infected, and there are numerous other physical manifestations that the individual experiences as the disease progresses. Some individuals will undergo blindness or blurred vision. Many other measurable signs are related to lack of muscle control. These include akinetic mutism, which is difficulty speaking, dysphagia, defined as someone who maintains difficulty while swallowing, myoclonus, where the individual undergoes many sudden jerky movements, dystonia, which is a neurological movement disorder in which sustained or repetitive muscle contractions result in twisting and repetitive movements or abnormal fixed postures. The movements may resemble a tremor. And lastly, the person may experience ataxia, which is difficulty while maintaining your balance. Ultimately, you can see that signs and symptoms are quite severe, and typically, as the disease progresses, the person ends up completely bedridden and often slips into a coma at the end stage of this disease. So the question is, are there any ways to prevent this disease or to limit your risk of exposure?
There is no known way to prevent sporadic CJD, and currently there is no cure for the disease. A number of drugs such as antibiotics, steroids, or antiviral agents have been tested on patients but have not shown any benefits. Individuals who are suspected of this disease should not donate blood or organs. In addition, in a medical setting, all of the equipment suspected to be contaminated with the disease must be removed and disposed of. However, the physicians may focus on mainly easing the control symptoms and making the patient as comfortable as possible.
While there is no cure or treatment for the disease itself, research is still being done with CJD. We hope that you'll have learned a lot, and if you or someone you love has or had any of the form of CJD, there are resources out there for you. There is CJD Foundation and National Institute of Health.